to give more awareness to the public, and what are the current treatments going on, and how the world is fighting against COVID-19 virus disease. Because lot of rumors, lot of unconfirmed reports, lot of treatment patterns, drugs without any verification have been circulating in the social media and news media. Simultaneously, the conspiracy theory also circulating, because some country created war against other countries. But I am not coming to that point. So far, there is no proof or evidence to finger a particular country. However, the situation is very grave and critical. First time the world is facing such a pandemic condition. The world never faced this kind of situation before. Because before we had seen a lot of epidemic diseases like cholera in olden days, simple flu, influenza flu, sometimes like jaundice, hepatitis infections, like a lot of diseases, viral infections we have seen before. But this disease, coronavirus, COVID-19, is a very dangerous, and moreover, when World Health Organization has quoted before, they have become clueless where it goes, where it is created, where the first breakout taken place. So a lot of questions are there. Despite that, all the countries equally, effectively and credibly fighting the COVID disease 19. As a public, what's our role? How to protect yourself? The first symptoms and signs and symptoms of coronavirus. In coronavirus COVID-19, 25% of the people who got already infected may become asymptomatic. They will not have a fever, what I have mentioned here. The primary and main complaints of COVID-19 disease: fever, sore throat, cough with mild sputum, body pain, shortness of breath, breathlessness, extreme weakness, chest pain, abdominal pain, poor appetite, that is called anorexia. These are the very common findings. We can treat that asymptomatic patient comfortably. They will not have 99% complications. This is the best way to overcome this disease. This is the only way to combat COVID-19 disease effectively. We have the investigations only at present. COVID kit. It's a simply drop method. The COVID infected patients will have non-specific little ECG changes. It may be looking like acute viral myocarditis. Acute viral myocarditis symptoms, they may have non-specific SCT changes. And chest CT is a very credible and reliable diagnostic tool or imaging study to confirm the COVID disease. In chest X-ray and chest CT, the findings will be the patchy consolidations in the bilateral lungs and bilateral opacity associated with patchy consolidations are reliable image findings in COVID-19 infected patients. Blood test, we don't do routinely all this investigation, but for your information, I am giving the blood test what are the findings, abnormal findings we can see in the COVID-19 infected patients, especially interleukin 6 is a cytokine overreactivation. Interleukin 6, interleukin 12, interleukin 1, interleukin 18, and tumor necrosis factor, cardiac troponin I, C-reactive protein. These are all the biochemistry markers very obviously found in COVID-19 cases. So based on these findings level, we can estimate the patient life complications, prognosis, whether the patient may go into complications or the patient may not go into complication, and we can treat comfortably without any risk. This role is every individual is playing a very important role. If you find yourself, if you realize yourself the complaints, please go to the specialist center and get tested yourself immediately. The treatment part nowadays varying with different countries and different set of medical facilities, even though, however, we are collecting updated information from WHO, Center for Disease Control, and Center for Infections Control. Other credible research centers are giving 24/7 medical informations, and they are sharing immediately to the world medical fraternity. As per the previous treated COVID-19 cases all over the world, oseltamivir is an antiviral drugs. 89.9% of the people treated with these antiviral drugs, they have recovered well. Along with these antiviral drugs, antibiotic moxifloxacin is a quinolone derivative antibiotics. 64.4% of the patients treated with moxifloxacin. Then next antibiotic, ceftriaxone. Ceftriaxone is a cephalosporin derivative group antibiotics. 24.6% of the patients treated with ceftriaxone. Azithromycin, 18.1%. Methylprednisolone, 44.9%. So far not used for COVID-19 cases. Other antiviral drugs, remdesivir, lopinavir, not yet used. But some countries, they have started using the drugs in the early stage of COVID disease without complications. Tradipitant is a neurokinin receptor antagonist, NK1. So this one research molecule is going on to inhibit neurokinin 1 receptor. Very commonly, very debatable and a questionable molecule. The recently American president himself claimed he found a molecule drug to combat COVID-19, hydroxychloroquine. This is a simple anti-malarial drugs before we used to do for malaria parasitic drugs. But the use of this drug in present situation is more questionable than answers, because in stable patients, those who are not having diabetes, those who are not having cardiac drugs, particularly ranolazine, statins, and antiplatelet drugs, particularly ticagrelor, prasugrel, and clopidogrel, they should not be prescribed hydroxychloroquine. And those who are on anti-arrhythmia drugs, especially amiodarone and digitalis like lanoxin, those group of patients should not be initially prescribed with the hydroxychloroquine. If there is any compulsory indication to prescribe hydroxychloroquine, they need to be careful because the patient may develop long QT interval in the ECG. What happens long QT interval in the ECG? Patient may develop ventricular arrhythmia. Ventricular arrhythmia followed by sudden cardiac death. Recently, one patient from Texas in US took 400 milligram of hydroxychloroquine. After the drugs, within 2 hours, he collapsed and died. This is the news reported from the medical journal, where they had not confirmed his previous conditions, because they found the reported news was after taking this hydroxychloroquine 400 milligram, patient died. But this is, I am not warning the treating doctors or the world population. This is a precaution. While prescribing this hydroxychloroquine, the prescribing doctors, the team of medical fraternity should be careful. They have to observe the ECG changes after giving the drugs, even after 2 days or 3 days, 4 days. Because the hydroxychloroquine half-life is almost more than 20 days. But in case of you want to prescribe hydroxychloroquine, initially patient can be given 400 milligram loading dose followed by 200 milligram BID for 4 days. So only short period of time. We cannot give hydroxychloroquine for more than 5 days. But at the same time, azithromycin along with the hydroxychloroquine, lot of heated discussions and arguments going between the expert medical fraternity and COVID fighting medical fraternity. Because ultimately, whatever the treatment we apply, whatever the treatment we are giving to the patients, ultimately their safety is very important. Compromising the safety of the patient by giving unproven drugs, complications in COVID-19 disease. Very major commonly found complications in ICU, critical care units. Acute respiratory distress syndrome. Almost 61.1% of the people go into acute respiratory distress syndrome, ARDS. Cardiac arrhythmias, especially ventricular arrhythmias, 14.4%. Shock. Patient may go into hemodynamic shock. Hypotension, sudden hypotension. They may not recover back after emergency measures. 30.6% of the people, COVID-19 infected patients, may go into shock. Multiple organ failure, 9%. Acute kidney failure, almost more than 9%. Pneumonia is equally 70%. These are the very expected, commonly found complications in critical care unit. How to overcome these complications? ARDS, effective antiviral drugs, and here we have to follow community acquired pneumonia protocol. Community acquired pneumonia protocol, all the emergency physicians, pulmonologists, experts, they know well how to start antibiotic, the combination of antibiotic dose, and the duration of the treatment. Cardiac arrhythmias, here we give antiarrhythmic drugs, but at the same time the selection of antiarrhythmic drugs in this situation is very important. The antiarrhythmic drugs should not compromise lung function and liver function, especially kidney function. We can give minimal fluids, less than 100 ml or 200 ml, followed by inotropic drugs, very important. Pressure drugs. The first priority of the pressure drugs, very important, noradrenaline. Second, pressure drugs, vasopressor drugs, adrenaline. Then inotropic drugs, dopamine, we can give. And this will improve the blood pressure during shock in emergency situations. The same protocol, community acquired pneumonia protocol, should be followed in the management of COVID-19 disease. So far, we don't have any specific antiviral drugs for COVID-19. Lot of hospital expert centers, specialized centers, they are using the antiviral drugs which they have used for SARS virus, H1N1 virus, previously Ebola virus. Because this COVID-19 virus is entirely completely different from those viruses because of the mutation, the structure, RNA structure, their legs, arms, palms, the difference from other previous viral morphology. The vaccines research is undergoing in different countries. Now the first phase of vaccine test in human not started. As per the current available credible informations, the vaccines for the COVID-19, it may take 1 or 2 years. Till then, we need to be careful. We have to follow all the instructions. The new immunity booster drugs also under phase 1 in the research. New anti-inflammatory drugs also under phase 1. Especially tocilizumab to antagonize interleukin 6 is undergoing. The new messenger RNA 1273 immunization vaccine is at phase 1. So all the new drugs, anti-inflammatory, anti-cytokine, anti-interleukin, anti-tumor necrosis factors, and the new interferon molecules are going. But it may take 1 or 2 years. Every individual is having 2 responsibility for their own safety and the societal safety, community safety. Wherever they are, their country is important. First, their life is priority. The second, this country is priority for them. The healthy population, the healthy individual make a country powerful economically as well as politically. So don't forget it. The best way to combat the COVID-19 disease in the present situation, as all the governments, all the countries insisting the public, their own citizens, to maintain best social isolation. The best social isolation, increasing the screening numbers is very important. Any country, I am not talking and not fingering out to any particular country. All the countries should do the maximum number of screening. Screening in the sense of simply checking the temperature, blood pressure, and asking the patient complaints not sufficient. Those who are having mild symptoms, those who are susceptible to the previous situations, they should be screened with COVID-19 kit. If the hospitalized patients should be taken immunoglobulin test, immunoglobulin IgM, IgG, and RT-PCR test immediately. And throat swab, saliva, droplets. As early as possible, if we follow all these measures, we can prevent the maximum number of death. So far, the mortality rate is less than 5%. The 5% varies from country to country. Some countries are having 2% mortality. Some persons are having 6%, some countries are having less than 6%. That's a very important. Here, how effectively we are screening and diagnosing and treating the patient in the early stage. The frontline warriors of COVID-19 disease are only doctors. So they should be given personal protection device along with N95 mask. Openly I am telling, we are not able to get personal protection device and N95 mask for the doctors, those who are fighting COVID-19 disease widely all over the world. I am not specifically pinpointing any country. This is the important for all the leaders, governing leaders, to take care of their own doctors who are treating the COVID-19 disease. It's like a war-like situation. How you are giving more sophisticated weapons, artilleries, missiles to the military, the same way this is a war-like situation. It is a responsibility of all the governments, all the political leaders to provide the necessary healthcare equipments to doctors. The public should use face mask for at least 1 year. You may think immediately after exit from the lockdown, you may be free, you may roam anywhere in the world without any safety. Don't think that way. It is very important. I am warning everybody in future, next 2 to 3 years, till we get proper vaccine, proper antiviral drugs, and complete eradication of COVID-19 from the earth. Everyone needs to be careful, should follow all the safety and precautionary measures while roaming in the public. Very simple solution, always use face mask. Poor people, middle class people, they are not affordable for disposable mask daily. Very simple. Take a cloth mask. You can stitch a 1 or 2 cloth mask. Use daily. While you are coming out, use it. The next day, immediately wash the cloth mask in the bleaching powder. Then wash it in the hot water with the detergent powder. After drying it, you can use regularly. This is the way to reuse the cloth based face mask. Poor people, no need to worry about the costliest or daily disposable face mask because it is unavailable even for the doctors. Because all the tailors in the world, they can do the service. They can stitch a face mask, cloth stitch face mask. They can even distribute to the poor and middle class people freely. Every individual is having the social responsibility in fighting the COVID-19 disease. Here the two communities are fighting aggressively COVID-19 disease. Medical fraternity. The second population, police personnel. These two population, fraternity, fighting 24/7 hours. So respect their service, respect their honesty, respect the rules. For FDA has not approved any drugs for COVID-19 disease. FDA so far never suggested any type of procedures. Whatever the drugs we are using, symptomatic and already evidence-based medicines. The recent paper, it is not a research paper, one single center study, they found the effect of convalescent plasma. That means the patient who recovered from COVID-19 viral infection, they take the blood from the patient and they separate the plasma from the blood component. That plasma can be used in critically sick patient of COVID-19 disease. But the result is not proven. The convalescent plasma treatment, FDA is so far not advised or recognized. Everyone should keep it in mind. Confirmed and expert report. Non-invasive ventilators, we used almost 46% patient. They have recovered very well. Invasive ventilators, 47%. They also recovered well. But if you see the pathology, pathophysiological findings, the COVID-19 disease first will attack the lungs. Then lungs will attack other organs, heart, liver, kidney, brain,